started in, or ran the pain rehab program up in Minnesota, and then got drafted down to Jacksonville, Florida, to warmer climate, and we've been unable to get him back up north, though we try. He is a phenomenal, not only clinician, but very entertaining speaker. So we're grateful for you to have traveled so far, Chris. Thanks, Dr. Sletten.
Well, good morning, everyone. It's great to see all of you. Just a couple of introductory comments. Sitting in the middle of this very packed week of information and perspectives on how to help patients in various stages of their pain or management of different health issues, I approached the topic this morning with some humility and also some perspective because I have had the privilege for the past 22 years working at the Mayo Clinic, a clinic with many resources, many dedicated and talented colleagues, and have been privileged to work in the pain rehabilitation program, both first in Rochester and now in Florida. And so some of my comments are made out of my experiences in those settings, and I fully realize that we've had the luxury of a very nice setup and a very nice program that runs well, and that's not available to everyone. So as you hear my comments this morning, please filter them as you need to your own individual setting, because I do realize that in the audience there are people of many different backgrounds, different amounts of resources for these kind of things. I just want to set the big picture, and really my goal this morning is to help you see and understand chronic pain from maybe a slightly different perspective, and maybe give you some nuggets on how to communicate with your patients, how to discuss the very difficult topics with them, and hopefully have a better clinical experience. By the end of this half hour, you'll see why I have no relevant financial relationships, especially with drug companies. So chronic pain, the topic, and actually as I go through this morning, I may slip into chronic symptoms. I'll clarify that later, but we are now actually able to help individuals with many different chronic symptom patterns in addition to chronic pain, but I'll focus my comments on chronic pain. Here's some of the issues with chronic pain. The symptoms are enduring, often in spite of very good and necessary treatments. The causes can be elusive. The treatments can be very exhausting, both in time and physical resources and financial resources. Many of our patients with chronic pain appear normal on the outside. I can't tell you the number of patients that I've seen that are very sick and tired of hearing.